Hi, I'm Dr. R. Padmakumar, HOD of Minimally Invasive Surgery at VPS Lakeshore Hospital and Keyhole Clinic, Kochi. We are regularly performing bariatric metabolic surgeries for treatment of obesity. We are the single center accredited by the Obesity Surgery Society of India as a center of excellence for bariatric and metabolic surgeries. People usually ask the cost of these kind of procedures, mainly thinking they may not afford the cost of treatment. Maybe from hearsay they understand it is very costly. But what we should understand is the cost depends on the place where you get operated, whether it is private or government. Government, it may not be costing you anything, but in private with very good facilities, it may be costing you few lakhs. Then second thing is, what is the procedure which is done? Whether it is a balloon treatment, gastroplasty is another minor procedure you can say, or you are going for a proper bariatric surgery like laparoscopic sleeve gastrectomy or a bypass procedure. So another thing is like your kind of medical problems you have, whether you have hypertension, diabetes, cholesterol, kidney failure. See, kidney failure patients will have to spend additional 1 lakh or so when you are getting admitted, because at this time you may be getting admitted for more than 3 days. Usually it's only 3 days. Instead, if you have a renal problem, you may be getting admitted for more number of days. Your medications may be different. You may go for dialysis if you are already on dialysis. So those costs also have to be added. Otherwise, regularly this balloon treatment will be 2.5. This gastroplasty cost also is 2.5 lakhs. Altogether expense I am telling, including all the medications, admission expenses, room rent, everything. That is called as a package costing. Additional things which you may have to spend is for the test which you do before surgery and the food expenses during admission, you and your bystander. Then the medicines which you have to take home to take for maybe few days. So these are minor expenses, but still it is the one which is not usually projected. In every place we usually try to give the package cost so that patients are aware what is the total expense which is there. So gastroplasty balloon treatment will be 2.5 lakhs. The sleeve gastro may be around 4 lakhs plus, and the bypass procedures may cost you another 50,000 more. See, that is the cost in a room category. If you want to spend less, you should opt for ward category. If you are having some insurance or you don't mind spending more for luxury, you can take even air-conditioned rooms. So 50,000 plus or minus is the expenses which you may have to spend. Another thing what you have to see is like the expertise of the team. That is very important. You should not just go for a cheaper treatment alone. You should see whether the center is equipped well, whether the surgeon has experience, whether he has got a very good team with him, because even the assisting surgeon, the team members, the nurses, everybody matter. The anesthesia support, everything will be mattering too good about this kind of procedure, because these are major undertakings for an obese and patient with multiple medical illness. So one should consider all these factors, whether you are taking it into a smaller place with lesser facility. You may save some money, but it is not safe to do that. Then other thing is materials used by the team. We always use best of equipments and best of medications so that the patient will get the best treatment in the world. So world-class treatment, you get it for a particular cost. You should not consider getting the cost reduced to a smaller place with lesser facilities, not that good materials for just saving the cost. Insurance companies support these kind of procedures if you are having insurance for maybe more than 4 years or so. So everybody should take medical insurance from beginning itself. In case you get into obesity and obesity related problems, if you have taken insurance for a longer period, you don't have to worry about the cost also. So get these kind of procedures done when it is really required. Keep yourself healthy. See, don't think of the cost and get yourself into the trouble of complications with the diabetes, kidney failure, heart problems, all those kind of things. And that will be much more expensive, and they may not be able to get you back to normalcy even with their procedures. So bariatric surgery is something which is like a one-time solution to get rid of major medical illnesses. Spending something for it is the best investment, because it is the best thing to do for your health and life. Thank you.